So my name's Zoe Harper. I'm the chair of the National Pain Group of the Australian Physiotherapy Association. I'm a titled pain and musculoskeletal physiotherapist, and I currently work as the senior clinician, physio and clinical coordinator at the Barbara Walker Centre for Pain Management at St Vincent's Hospital here in Melbourne. So the APS is the peak body for multidisciplinary pain management in Australia, and this is the 45th year that the conference has been running. On Sunday we had our physio pre-conference workshop with Alicia Rayner, who presented on a pain-informed approach to the management of migraine and tension type headache. So that was a really wonderful session with some great practical strategies for physios to use. Then across the course of the conference program over Monday, Tuesday and Wednesday, we've had a variety of different physios presenting different topics. We've got researchers presenting on, all the latest stuff coming out from the research field. We've had different people presenting on different programs that they're running and new ways of thinking around pain. The other thing that's really lovely about the APS conference is that it is an interdisciplinary conference. So not only is there great physio speakers and presenters, but we get to collaborate with our other colleagues in this space, and we get to learn from each other, and that's a really wonderful thing. I think it's really important for physios to keep up with the latest research in pain because it is a really evolving space. The research landscape has changed a lot over the last 50 years, and our understanding of pain as a scientific community and as a clinical community has really changed along with that as well. There have been some really awesome talks that I've heard this week about research that's even just coming out in the last 1 to 2 years that's providing additional insights into the way that we approach pain and different things that we can try with our patients in order to get better outcomes. I think it's incredibly important for every physiotherapy clinician to have a good understanding of pain, because that's often the main reason that people present to physio. My back hurts, my knee hurts, my neck hurts, whatever it might be. And so I think for clinicians we need to have a really good understanding of pain and all different pain types in order to be able to effectively manage those patients. So we need to have a really good understanding of acute pain, chronic pain, and that big grey area space in between as well. One of the main things that I'm hoping to learn at conference is really just some practical things that I can take back to my clinical practice when I'm working with patients. There was a fantastic session yesterday on nocebo and the potential impact that we can have as clinicians when we're giving healthcare information to patients, and are we inadvertently creating a nocebo effect with our patients. And so that's definitely something that I'll be taking back into my clinical practice. I think it's incredible that the APA are able to sponsor the physio pre-conference workshop at the APS conference. The APA has done this for more than 10 years, and I think it's a wonderful collaboration that we have between the two organisations. By sponsoring the pre-conference workshop, it really boosts the profile of APA within the physiotherapy community, but then also within the multidisciplinary landscape. So the APA is also represented at the APS Relationships Committee, which is a group of multidisciplinary practitioners who come together to collaborate and advocate for the broader landscape of pain care and pain management within Australia. So we have representatives from physiotherapy, from OT, from exercise physiology, from psychology, from pharmacy, from the Faculty of Pain Medicine, RACGP, the list goes on. And it's a really wonderful space to be in so that we can work together to address the issues that are affecting every Australian who's living with chronic pain. Events like the Australian Pain Society Conference are incredibly important in helping us to advance the understanding of pain, both within the physiotherapy profession, the wider involvement of different clinicians and disciplines involved in pain, but then how we treat our patients and then the broader community understanding of pain as well. And I think it's a really wonderful opportunity for us to all come together and collaborate, to learn from each other. And there's always a wonderful sense of community and connection at these sorts of events.